and I'll hand over now to Matt and Barbara.
Lovely. So we're just going to share our screen. So can everyone kind of see the PowerPoints come up okay? Yeah, perfect. So we're just going to be talking a little bit about sleep after stroke. So we work at the Wellcome Centre for Integrative Neuroimaging, which is based in the University of Oxford. For my background, I've done a master's in sleep medicine, so I have a lot of interest in sleep. And Matt, if you want to say about you.
Yeah, hi, I'm Matthew. I also work with Barbara, and I've recently finished my PhD, which was looking at kind of motor learning and recovery and rehabilitation. So understanding how we're able to kind of move and recover after brain injury.
Yeah, so kind of combined, we have kind of the kind of movement and rehab learning, and then the sleep elements as well, which we'll discuss today. So in terms of sleeping after a stroke, so it's very common for people who have had a stroke to experience changes in sleep. And these changes can occur in the hospital, kind of initially after the stroke. The hospital environment we know is not very well suited for sleep. There's a lot of noises and potentially a lot of light and a lot of things going on. But sleep changes can also occur in the home and more long term. And what we found is that stroke survivors tend to have more disrupted sleep and more time awake throughout the night. And there's additionally links between poor sleep and recovery outcomes after a stroke. And so studies have shown that poorer sleep often show worse rehab outcomes. And on the other side, better sleep is often associated with quicker recovery. And so there are different types of sleep disturbance that people can experience. And for stroke in particular, these ones are quite common. So first of all is insomnia, and this is where people experience difficulties with falling asleep, with waking up in the night, or waking up too early. And what the general tips to improve that kind of include keeping a regular sleep schedule, practicing relaxation before bed, making sure that the sleeping environment is comfortable. So that means making it a nice temperature, not too hot, not too cold, and also dark. And also avoiding screens right before bed. And finally, one of the main recommended treatments for insomnia includes something called cognitive behavioral therapy for insomnia. But that's something we're kind of going to touch on a little bit later in our talk. So we'll come back to that. One of the other sleep disturbances people might experience is something called sleep apnea. And so this is where breathing can stop and start during sleep. Now, this one can be a little bit harder to figure out by yourself, but people might tell you that you snore very loudly or that they're kind of waking up gasping for breath. And for this one, if it is something that is a bit of a concern, we recommend talking to the GP. And so they can suggest lifestyle changes, such as stopping smoking, doing more exercise, or reducing alcohol intake. But they can also suggest more formal treatments, such as CPAP, which includes wearing a mask at night. But again, this one is definitely a recommendation to talk to a GP if that's something that is a concern. And finally, we have sleep cycle disruption. And this is where normal sleep patterns can be changed. So people might wake up too early or have struggles going to bed late. It can very much depend, but it just feels kind of maybe a bit like jet lag, where things are a little bit out of sync with the timings of the day. And the recommendations that we have for this one is to keep a consistent sleep-wake schedule, and bright light in the morning can help people feel more awake early in the day, whereas bright light in the evening can help people stay awake longer. And that just depends on kind of your sleep patterns and what you would like to adjust. In terms of reasons for changes in sleep after a stroke, there are kind of lots of different reasons it might happen. So first of all is the brain injury itself. So depending where in the brain, it may have different impacts. So areas in the brain that are related more to the sleep functions may have been affected, and that might be one of the reasons that changes in sleep occur. But we also know that there are changes in daily activities and routine after a stroke. And so kind of having a different schedule or changes to schedules and activities can impact our body and kind of how tired we feel or how easy it might be to get to sleep. And then we also have medications. So people often get given medications that might have side effects that affect sleep, as well as pain and incontinence. So these kind of side effects of stroke or accompany stroke, but also older age, can also impact how we sleep and how we experience the night of sleep. And finally, changes in mood. So we know that depression and sleep and insomnia are very interlinked. So people who sleep badly might have poor mood, but poor mood can also impact the sleep, and there's kind of a little cycle that happens there. And we know also that kind of after a large kind of life event can kind of have these changes in mood. And that's also one of the reasons change in sleep might occur after a stroke. And it's also worth noting it might not be just one of these things, but it could be a combination as well.
So one of the things that we're really interested in our research group that's looking at kind of sleep after stroke is the ability to regain movement. So over kind of 50% of stroke survivors will experience some kind of long-term movement disorder or disability after their stroke, meaning that they're not able to move or act as well as they were prior to their stroke. And that's why we engage in rehabilitation to try and regain that function. So movement recovery after a stroke is dependent on this relearning of the previously known actions. And what we often call that is motor learning. And the more you're able to kind of repeat these rehabilitation sessions and repeat these movement exercises during those therapy sessions, you're able to drive changes in the brain, which allow you to kind of help recover. And when we talk about changes in the brain is really adaptable after an injury like a stroke or other types of neurological conditions. And often people describe a rewiring process. So potentially parts of the brain that are damaged and no longer are able to act as they were, which is why people after stroke have impairments of movement. We see these changes in the structure and the function of the brain, which are able to rewire those pathways that allow us to regain function after a stroke. And like I said, repetition kind of during practice is really important for that. But we also think sleep is important for that recovery and function. And that's because sleep has many functions in lots of different settings. And I think Barbara laid out quite a few from kind of why people have sleep changes. So it links to that. But specifically for movement, we know that when we are doing things in rehabilitation sessions, so when you're practicing these movements during rehabilitation sessions, the same parts of the brain that are active during that practice also become active during sleep. And we think this reactivation during the sleep is when we're able to kind of transfer the memory of that movement and that learning between shorter term stores and longer term stores, meaning that kind of when you're recovering and doing sessions repeatedly week on week, you're able to remember better how you were able to make those movements, and those pathways between the brain and the limb, the muscle, are strengthened, and therefore you're able to kind of improve more so when you're practicing itself, but then also these kind of secret improvements that happen during rest and sleep. So obviously, as Barbara outlined, sleep can be affected. by stroke. We're interested about how that might affect the ability to kind of remember and learn how to move, and how that might impact on the long-term recovery of people that have had a stroke. And when we kind of talk about research in this setting, we often conduct clinical assessments, so assessments of how well you're able to move your hand or your arm or your leg, how well you're able to kind of walk from a certain place to another or get up off a chair. And we can assess those kind of pre-intervention and post-intervention and see how well people have kind of adapted and how well people have recovered. And we also can use these kind of funky lab-based tasks that you've got here that allow us to kind of assess some different types of mechanisms of movement. So we can look at speed of movement, we can look at accuracy of movement, we can test how well you're able to contract and relax certain muscles and how that might improve over time. And we kind of use these lab-based tasks and these clinical assessments in our research to assess how well movement learning has changed and how we're able to kind of promote recovery throughout the journey of our research through people that have had a stroke. So we're just going to quickly touch upon some of our past research, which some people in this group may have been involved in as we recruited from various different events, but one of them was a kind of a presentation in a previous meeting. And then we'll touch upon some future research, which may be of interest to some of you in the audience as well. So as we've kind of highlighted, our research is really focused about how we can improve sleep and how that might kind of improve outcomes in people that have had a stroke. So our initial study kind of looking into this was called the INSPIRE study. And its overall aim was to see if, its primary aim was to see if can a digital sleep improvement program, so that's what Barbara touched upon earlier, and she'll go into this a little bit more later, but it was a digital improvement program. Can it improve sleep after stroke? So for those who suffer insomnia, it is the kind of first line of treatment that is suggested to help improve their sleep, but we didn't really know how that might factor in terms of people with using this program who've had a stroke. And as it's not kind of clinician-led, it's a digital program that you can access through your phone or computer. We wanted to see if that was kind of usable by stroke survivors and if it indeed did help their sleep and other aspects. So if we can see from this graph, and I promise this is the only graph on this slide, up this y-axis here, we have a better sleep rating. So we used a clinical rated research questionnaire to assess how well people are sleeping before they started the use of this online cognitive behavioral therapy program, or if people were just giving some information about how to improve their sleep. So we assessed how well they were sleeping before, and then we split them up into those two groups. And what we could see at the end of that program, which is about 10 weeks long, people that had had this digital program to improve their sleep actually scored a better rating. So they were suggesting that they were sleeping much better than the people who were just given a few tips and hints. And then we wanted to kind of assess the longevity of this. Is this lasting beyond the actual program itself? And what we found also is if you look at the 2 months later column on the y-axis, you can see that indeed people who were on this program, which helps improve sleep, had this longevity effect. So they were actually sleeping better 2 months after they had stopped using it. So I guess some of the practices that were used in the therapy were kept up and able to kind of improve their sleep. And that's really great. And that shows that this program is usable, and then we can kind of continue this line of research going forward. But one of the other aims we wanted to look at is to see if can it also improve other aspects of kind of life, mood, and well-being. And what we found was that in terms of specifically anxiety and depression, the use of this digital cognitive behavioral therapy program improved symptoms of anxiety and depression in those who used it compared to those who just received that hygiene information. And that kind of helps us understand the complex links between sleep and stroke, and also kind of these other measures of lifestyle, and help us untease how we are able to kind of help people going forward in both movement and sleep, and then also in well-being measures as well.
So to follow on from that, we're now conducting the Inspires 2 study. So again, it's still testing that same sleep improvement program. And we're currently kind of recruiting participants. So if anyone's interested, at the end, we'll kind of run through what kind of eligibility criteria we're looking for. But just building on from the Inspires 1 study, as well as looking at the sleep measurements, we're now also looking at how improvement of sleep may also impact the movement learning that Matt was talking about earlier. And so what is involved in the study is, at step 1, there are some questionnaires about sleep and mood, as well as the sleep assessment. So there's a sleep watch and a sleep diary, and we'll show you a little picture of what that sleep watch looks like. But what that does is measure movement and give us overviews of sleep-wake patterns. And then we also use a movement learning task, and we'll also show you what that task looks like as well. And once that step 1 is done, then what we do is randomly allocate into 2 groups. So group 1 continues treatment as normal, and group 2 is assigned to the online sleep improvement program. It's worth noting as well that anyone in group 1 will still get access to the improvement program. It'll just be at the end of the study. And what is involved in the sleep improvement program is it's a cognitive behavioral therapy for insomnia. And so it has different modules that become available each week. And so there are 6 sessions, and we run that over a 6 to 10 weeks to give people a bit of time. We know that sometimes people are a bit busy, so there may be 1 week which is a little bit delayed. But each of those modules provide tips, but also techniques and methods to improve sleep. And then what we do again at step 3 is those same questionnaires, those same sleep measurements, and the same movement learning task. And what we'll be able to find out from that is if the sleep improvement program is working, but also to compare the effects of improved sleep on that movement learning. And what we're expecting to see is that improvements in sleep will also show improvements in the movement learning. And then finally, at the end, we have another additional optional component, which is just training on the movement kind of learning and training. So we provide the kind of device that we use to learn the movements, and we kind of leave that for 4 weeks and just kind of see how much those are used. So in terms of the equipment, we have a grippable, which is a commercially available device. You want to talk a bit about that?
Yeah, so the task itself involves gripping and releasing, and I think we've got a video here. Yeah, gripping and releasing of the gripple itself. And what this does is it's provided with a tablet, and it moves an avatar on a screen in different directions. So if you squeeze, the avatar will move up, and if you release, the avatar will move down. And the aim of the kind of learning task is to learn the pattern of that grip and release to direct the on-screen avatars to as many targets as possible. And we ask the participants of the study to train on it 10 times before they go to bed and get as many stars as possible, then have a night of sleep, and then be tested on it in the next morning to see how well they've learned and consolidated that learning to the next day. As we know, those things happen during sleep which help consolidate that learning. So we're testing basically to see if there are any improvements after a night of sleep, and then longitudinally, if we improve sleep, how much does that improve the learning? And then the watch on the other side, again, it's just an actigraphy watch, which measures activity. So we ask participants to wear that on their least affected side, and that will measure kind of when people are awake, but it'll also give us an idea of when people are asleep and how disrupted their sleep might be during the night. And we can get different metrics from that watch in order to kind of tell us how well people are sleeping, which we use the sleep diary just to corroborate with as well.
So in terms of getting involved, for the Inspires 2 study, there are just some bits that we need to make sure that our participants kind of meet. So we're first of all looking for stroke survivors who are looking to improve their sleep. So this can be any point from your stroke up to years later. Just anyone who's previously had a stroke may be struggling with their sleep, or may just wish to sleep better than they currently are. And so we're also kind of looking to have some upper limb impairment. They do still need to be able to do the task, so be able to kind of grip and release to some extent. And then also just a reliable access to the internet. And that's just because the sleep improvement programme is all done online. So that internet is just needed to facilitate that. And then also not have done Sleepio in the past, or within the last year done any other psychological therapies for insomnia. But we do kind of go through some screening questions just to make sure that the study is suitable and safe for anyone who is interested in taking part. We do also run some other studies in our group, and we can kind of add anyone who might be interested in research in general to a contact list to receive information about other opportunities. Now, being on that list doesn't mean you have to take part. That's just to say that you're happy to receive information about what's going on. And then finally, we've got a stroke research update newsletter. So that's not just our sleep research at the university, but also some other groups who run general stroke research as well. And we have a mail list, and that's to receive a little newsletter a couple of times in the year, just with some updates about what we're doing and what we've found from our studies.
So all the information is here, but I will copy and paste it into the chat so it's more easy to access. But if you want to take like a picture or a screenshot of that now, I'll leave it up for a few seconds. But I'll also paste all that information into the chat for you in a moment as well. But that is kind of all the kind of upfront talking from us, and we'd be more than happy to take any questions or discuss some of the research further. And then also, yeah, we can look forward to kind of speaking with you in the future as well.